gallstones do not show any symptoms. However, as the stones grow larger or get trapped in the bile ducts, blocking the bile flow, symptoms will start to appear. A gallstone attack can cause intense pain, making it impossible for the person to stay still. The pain is often described as sharp, stabbing, gripping, or cramping.
The gallstone are asymptomatic, but when gallstone does cause problem, the most common problem that the patient will have is pain.
The pain due to gallstone are very typical and normally is in the upper abdomen, which is severe and sudden onset of pain, which can last for minutes to hours, especially after meal.
It can be as simple as just bloating, feeling gassy, or it can be nausea and vomiting, and the pain can be at the epigastric, right at just below your breastbone, or sometimes at the right side of the abdomen.
And other symptoms when the infection happens will include fever, chill and rigor, and also sometimes in a severe infection causing sepsis, or blood pressure may even drop.
Symptoms that occur when gallstones enter the bile ducts and cause blockages include sudden worsening pain in the abdomen, pain in the back and right shoulder, stomach discomfort and digestive issues such as bloating and heartburn, nausea and vomiting. Individuals should seek immediate medical attention if they experience any of the following symptoms: jaundice, yellowing of the skin and eyes, sweating, chills and fever, dark urine and pale stools.
The gallstone pain sometimes can mimic other conditions in medical. For example, your gastric pain, very typical. Sometimes after you have the typical upper abdominal pain due to gastric, sometimes due to pancreas, pancreatitis. Even people with heart attack have a similar pain at the pain over the epigastric or over the lower chest.
Certain people will say that the pain is very severe. It could be as bad as childbirth or a heart attack. Okay, so sometimes similar condition that can have similar pain. It could be gastric ulcer pain, pancreatitis, atypical heart attack, or even gastric reflux symptoms.
The other condition, of course, a lot of internal organ with infection. For example, your intestine, liver, etc. also can mimic a stone of the gallbladder.
So sometimes the symptoms might be quite overlapping. So that's why when you have these symptoms, you need to go to the hospital to have it checked out.
There are several health issues or conditions that can disrupt the normal secretion or levels of cholesterol and bilirubin in the bile. However, not everyone who develops gallstones has underlying health problems.
But what are the risks of gallstones? Aging, family history, gender, especially in women, overweight, rapidly losing weight, and of course, your high-fat, high-cholesterol, low-fiber diet that we all love to eat.
Risk factor of gallstone, as most diseases have, we know that a lot of diseases are associated with our genetic makeup and our lifestyle choices. It's usually a combination of both. But we do see a few things that actually increases the risk of getting gallstone. First of all is obesity.
Of course, obesity is the main cause of the gallstone. And the other cause including high cholesterol, hypercholesterolemia, and increased concentration of the cholesterol in the bowels, causing the formation of the crystal and also stone in the gallbladder.
So other causes of gallstone that we found more common, it happens to be seen more commonly in female patients or patients who are more than 40 years old, patients who are fertile.
This will happen in women in pregnancy or people taking a hormone replacement therapy. The high level of estrogens contribute to the formation of the gallstone.
is a major risk factor for gallstones. Research has shown that overweight or obese individuals are more likely to develop gallstones compared to those with a healthy weight. This is because excess fat in the body increases cholesterol levels in bile. Obesity can also affect the gallbladder's ability to contract, slowing down the release of bile into the small intestine. As a result, bile can stagnate, increasing the risk of gallstone formation. Obese individuals often face other health issues, such as diabetes and high cholesterol, which also contribute to the development of gallstones. While weight loss is an effective strategy for reducing the risk, rapid weight loss, especially through surgery, can have the opposite effect. Sudden weight loss may cause the liver to release excess cholesterol, leading to gallstones. Other risk factors for gallstones include aging. People over 60 are more likely to develop gallstones than younger individuals. Estrogen. Women are 2 to 3 times more likely to develop gallstones than men. Excess estrogen levels in women can increase cholesterol and reduce gallbladder function. Genetics. Individuals with a family history of gallstones are more likely to develop them.
Sakit tu memang tak boleh nak cakap lah. Kalau 0 sampai 10 kan, dia dekat nombor 9 kalau dia memang sakit betul. Dia sakit dia memang datang terus. Dia memang angkat terus kan. Bila dia kena tu, kalau kita badan tu, kalau dia datang, kalau kita tunduk kan, bila kita tunduk, kita memang susah kan, kita nak tegakkan balik lah badan kita kan. Bila kena tu nak berguling lah, memang sakit.